everyone. My name is Ruth Sliviak, and I'm an insurance broker, and then I also do investments. And my wonderful topic is going to be planning for retirement, and we're going to obviously pay a little bit of additional attention to some of the things that could be coming up in all of our futures at one point or another, at least in a family member's situation. With regard to retirement, I'm going to touch on a little bit about Social Security, and I'm sure some of you might already be collecting it. Some of you are looking forward to collecting it, and some of you are hoping it'll be there when it's your time. So that's another topic for another day. You have an option of basically three choices. You can retire early, you can retire at your normal retirement age, or you can retire after your normal retirement age. If you retire early, there are penalties, and I've outlined, I'm not going to go through the detail because I don't know that this is really the main focus of my talk, but if you retire early, like at age 62 for some of us, your benefit is actually going to be reduced. So you have to take that into consideration when you're thinking about that. So you wouldn't be able to collect your full benefit. And there's a special formula to determine what your actual benefit would be. You also have the option of retiring at your normal Social Security retirement age. The earlier you were born, of course, the earlier that would be. For a lot of us, it's at age 65, and then obviously it gets to be quite a bit older depending on your actual year of birth. If you wait to retire, there's an extra benefit for you, and there's a whole formula on how it's calculated as to what your actual retirement benefit would be if you chose to wait. So a lot of folks will consider doing kind of a split retirement, which we'll get into. But if you were born between or earlier, or the age of, born on 1937 or before, you get to retire at 65. If you were born as late as 1960, you're going to have to wait until you're 67 to retire, and then there's obviously ages in between depending on. Considerations when you're thinking about retiring, or considering drawing your Social Security, you're obviously going to most likely have a lower monthly income. You want to make sure that you've evaluated your fixed costs, what your actual living expenses are going to be, and then what your other income sources might be. You might be able to draw Social Security, you might have had a pension that you're able to draw, a 403B if you were in a more charitable type of a job. You might have a personal IRA, you might have some other annuities that you've established over the years, and those are all sources of income that you need to take into consideration. If you are considering still working at age 65, you have to be careful because based on what you work, it's going to potentially reduce your Social Security benefit. So you want to really be careful and think about what you're doing with regard, especially to Social Security, because it's very regulated as to what could happen based on certain decisions that you're going to potentially make. You want to think about if you're married. If you're married, what's going to happen if you decide to retire early, and then how that could impact your spouse. Your health and your spouse's health. I have an uncle who is not in good health, and he opted to retire at age 62, and thank God he's still with us, and he's 72, and he's doing okay, but he has had to do a little bit of work on the side just to kind of supplement his income. He wasn't, I think he was thinking that things weren't going to go so well. Considering a split strategy. Let's say the lower income earner might decide to retire early. The higher income earner might decide to wait to retire. That way, while you've accepted your Social Security benefits, being the lower income earner, you've had that replacement of income coming in, your spouse is continuing to work so that he can then, or she can then collect that higher income level at that point. Think about those known expenses that you're going to have, and think about what could happen, the God forbids, the other expenses that could come up. You have to think about your Medicare B premiums. If you opt to still work and you're in a small employer environment, you are going to be forced to take Medicare B if you're in a group of less than 20 employees, let's say. And with that, if you're a high income earner, your Medicare costs are going to be expensive for Medicare B. So you want to think about that. You want to think about your taxes, inflation, all those things come into play. How do we plan for all of this? What makes sense? What do we need to think about? Do we want to consider diversifying? Of course we want to diversify. The more mature we're getting, the closer to retirement, we want to become more conservative with our investments. We want to look at things that could produce a steady income. We want to preserve what capital we have, and we still want to have some level of growth. There's all sorts of strategies using bonds with staggering dates of maturity to have income that could potentially come in, looking at real estate, whether it's with a REIT, a reinvestment, a real estate investment type trust, or whether it's property that you own that can become an income stream. High yield stocks, the higher end blue chip stocks that are going to be income producing and give you some level of stability. And then, you want to look at what you have as far as your stockpile, your financial picture, and think about pulling out roughly 4% to help supplement your income. That's kind of a good gauge with regard to what you might want to be able to pull out from that retirement source. Always think about, there's risk. Nothing is guaranteed, and especially when you're, in the market. We've all seen the ups and downs, and I don't think that'll ever go away. It's a great way to have appreciation and to have growth, but you have to be wise, and you make sure you are diversified to help prevent things from becoming unbalanced and then not have what you want at the end of your, when you're ready to accept retirement. Talking about health insurance and options, and this is open enrollment for all of you, or if anyone that's on Medicare for your Medicare D plan, so anybody that's on prescription drugs, this is the time to make sure that the prescription drug plan that you're on is going to meet your needs. There's a wonderful tool, it's the government, it's the Medicare.gov, and you're actually able to enter in your prescription drugs, enter in what pharmacy you like to go to, and then it'll tell you, it'll spit out all of the different carriers that are available in your area, and it'll let you know by a summary as to which plan is going to be the most cost effective. I don't sell Medicare D plans just because there's a gazillion of them and all the certification for each carrier is just overwhelming, and it's not a productive use of my time. But what we do for our clients is we will run those Medicare D checks for them. And the formularies for these prescription drug companies change every year, so it's really, really important. I just did one for my uncle. If he would have stayed with his current plan, he would have been paying $12,000 a year for co-pays, his premium, and deductible. Doing the search, he's down to $3,000 a year. I mean, that's a huge difference, and that was a plan that we just did last year for him. Can't stress that enough. With regard to Medicare, Medicare A covers hospitalization. Medicare B is what covers outpatient services, doctor's visits, hospice, things of that nature. Medicare supplementals fill the gap from what Medicare doesn't, what they might have a deductible, there might be co-insurance that you're responsible for, and these Medicare supplementals pick up that difference. There's also Medicare Advantage plans where you kind of give up your Medicare rights, so to speak, and you're in a Medicare HMO. They're great for some people. They're not great for everyone. They're not great if you travel. So there's a lot of considerations with regard to just your basic health insurance coverage. Associated costs can be estimated, but a change in health and prescription drug usage can dramatically increase expenses, and it's very difficult to plan for. Like those Medicare D checks that I was talking about, each year we run them, but open enrollment only comes once a year, and once you've elected that plan, you're locked in for the year. The other topic which both the young ladies had spoke about was long-term care. Medicare covers long-term care very, very, very minimally. And you might as well not even really consider it. The criteria is very strict. It's based on a hospital stay. Medicare does not cover custodial care. Custodial care is when you're not able to do your activities of daily living. You're not able to feed yourself, transfer, getting from a bed to a chair, bathroom, incontinence, cognitive abilities, not being able to do your daily care. That is not covered by Medicare. That's when you have a family member step in, or you're paying for outside help to come in and guide, help you through those challenges. Medicare only pays for medically necessary skilled care in a facility. So if you want to have your care rendered to you at home and you want to be able to stay in your home for as long as possible, things like long-term care or your assets are really what's going to help you to be able to get there. And you go like that. It's very, very expensive. Average cost right now in a facility, and I'm not talking the Taj Mahal, I'm talking a kind of an average facility, $240 a day. And that's ever changing. So things to certainly keep in perspective when you're planning for your retirement. If you are insurable, I would strongly encourage you to investigate long-term care. There's other ways to cover those expenses, but long-term care is certainly a great way to have control of where your care is rendered and where you're going to end up being potentially. Again, it does cover, meaning long-term care covers custodial care in your home or in an adult daycare facility, in an assisted living, or in a nursing home. You have to be, in order to be eligible for that benefit, there's waiting periods, and that helps control cost. There's duration, how long that product is going to pay in the event that you need care. Whether there's any inflation protection, there's a lot of variables with regard to long-term care to help make it more affordable. But it's definitely something you want to look at before you're having health issues. The underwriting is getting more and more challenging because these long-term care companies are merging, they're limiting benefits. We used to be able to sell an unlimited lifetime benefit. Try to find it now. We used to be able to sell 10-pay products. So if you were a young professional, 40s, 50s, you bought it while you had that high income opportunity, pay the premium, at the end of 10 years you were done. They're not available anymore. So the industry is changing. The triggers for long-term care are not being able to perform 2 out of 6 of your activities of daily living. So bathing, continence, dressing, eating, toileting, or transferring. Cognitive impairments, things like dementia, Alzheimer's. So again, you want to think about the elimination period, how long you're not able to do those things before the policy would kick in, how long the policy will pay, inflation protection, there's policies with waiver of premium, premium refund. A lot of people, the objection to long-term care is, I'm going to pay for it, and then if I never need it, I've paid a lot of money. Sort of like your car insurance, your homeowner's insurance, you never have a claim, but you've had to pay those premiums. So some policies you can purchase riders where if you end up never needing the care and passing away, that money comes back with interest. There's some more creative ways to cover long-term care. There are life insurance products that cover long-term care. And even a traditional life insurance product, a lot of them have built into them an enhanced accelerated death benefit, so that if you are in a situation where you are going into hospice or you've been deemed by a medical professional that you have a very short life expectancy, your life insurance policy can pay out, and that can help with some of the cost associated with that. There are tax qualified plans, so there's some benefits with regard to that. And I'm going to leave with this note, the National Retirement Risk Index, which is sponsored by Boston College Center for Retirement Research, found in March of 2010 that 65% of retirees were at risk of not maintaining their style of living in retirement when health care and long-term care were included in their needs and assets assessment. Thank you all.